Hi, I'm Siri Shastry. I am a research fellow at the Department of Emergency Medicine at the Icahn School of Medicine at Mount Sinai, and I'm going to be discussing emergency department utilization patterns in patients with opioid-related ED visits. I have no conflicts of interest or disclosures. As you're likely aware, the opioid epidemic has been a major national public health crisis. The figure here is depicting the national rate of opioid-related inpatient and emergency department visits. As you can see, from 2005 to 2014, the visit rate for both has been steadily increasing. Although we know that the emergency department visit rates for opioid-related reasons has been increasing, we have limited data on the overall ED utilization patterns of these patients. An improved understanding of this may allow us to better identify missed opportunities for screening, intervention, and referral. Accordingly, our study aimed to investigate ED utilization patterns in patients with opioid use disorder. In order to do this, we performed a retrospective matched case control study with a matching ratio of 2:1. Patients were matched on the basis of age and gender. The study was set at a single urban emergency department. We defined cases as patients with an opioid-related index ED visit from June 1st, 2017 to May 31st, 2018. We defined opioid-related visits on the basis of ICD-10 codes that had previously been well validated in the literature. We defined controls as patients with a non-opioid-related index ED visit from June 1st, 2018 to May 31st, 2019. We collected data on patient demographics, visit information both for the specific index visit as well as for visits 12 months prior to and 12 months following this index visit. We also collected data on patient medical comorbidities. Our primary outcome was the association between being a case patient, in other words, having an opioid-related index visit, and the number of ED visits in the 24-month period pre and post the index visit. We used Cochrane-Mantel-Hansel statistics and conditional logistic regression to perform our analyses, and we adjusted our analyses for the number of comorbid medical conditions. We had a total of 224 cases. Mean age of our population was 44, and the population was predominantly male. Our cases had a median of 1 medical comorbid condition, while controls had a median of 2 medical comorbid conditions. This figure is depicting on the left here the mean number of visits 12 months prior to the index visit for cases here in the light green and controls in the blue. As you can see, the case patients had a higher mean number of ED visits prior to the index visit compared to the control patients. And this here is depicting the mean number of visits 12 months following the index ED visit. And similarly, the case patients have a higher mean number of visits when compared to the controls. When we performed further analysis, we found that having more than one ED visit in the 12 months prior to and 12 months following the index visit was associated with over 4 times higher odds of being a case patient. In other words, more than 4 times higher odds of having a opioid-related ED visit. So it appears that patients with an opioid-related index ED visit have higher rates of ED utilization both prior to and following the index visit. These pre-index visits that we identified may be a missed opportunity for early intervention and referral prior to the index event and may in fact be helpful in preventing that said index visit from occurring. Our study did have several limitations. We had, at the time of writing of this abstract, incomplete control follow-up data based on the dates that we were looking at for the 12-month following the index visit. Our study was also observational and retrospective in nature. It was limited to a single site. We did not match patients on the basis of medical comorbidities, and we had overall just some limitations in the data we were able to obtain. In conclusion, patients with an opioid-related emergency department visit had higher rates of emergency department utilization and were much more likely to have had more than one ED visit surrounding their index visit. there's likely missed opportunities for ED intervention and referral. Further research is needed in order to better identify these opportunities and to explore how to best capitalize upon these opportunities to prevent opioid-related visits from occurring. These are my references. Thank you very much for your attention.